And I'm really pleased that the CEO of Columbia St. Mary's is here, Leo Bordeaux. And Leo, if you share some thoughts with us, please.
Thanks very much, Governor Doyle. Governor Granholm, thanks for hosting us as well. And Ms. Barnes, thank you. And thanks to the President for making healthcare reform a top priority. It really has to be. Wisconsin's hospitals have been working in partnership with Governor Doyle to put in place a number of pragmatic solutions that, as the Governor indicated, have greatly increased access and coverage to care in Wisconsin, to the point where in Wisconsin we have one of the lowest rates of uninsurance of any state in the nation. So first piece of advice would be, let's keep it pragmatic and basic as we reform healthcare. But the goal of national healthcare policy has got to be 100% coverage and 100% access. This is not a policy question, it's a moral imperative. But if we're going to be able to make that statement, that declaration about 100% access, and have it mean anything, we've got to get healthcare costs under control. So I have three strategies to suggest in terms of getting those costs under control. First is to change the financial incentives. Today, hospitals and doctors are paid piecework. Instead, we need to be paid to keep people healthy as opposed to being paid to treat them when they're sick. I believe employers ought to be structuring their benefits to incentivize their employees to choose high-quality, lower-cost healthcare providers. Let's have us compete on the right things. And let's create financial incentives for patients to be smarter consumers of healthcare. Second area is reducing unnecessary care. The Dartmouth Atlas project has been showing us for decades that there's a wide variation in the utilization of healthcare services across the country that bears no relationship to need and probably doesn't contribute to improved health status. And so we basically need to understand and put our money where into healthcare that is effective. And so the $1.1 billion that's been included in the economic stimulus package is an important down payment in that research to help us discover what's important. Secondly, and this may not be popular, but we spent an awful lot of money in the last 6 months of life. And we need to have a better end-of-life system. Sometimes we need to realize that a good death is a good outcome. And then the third area, I would say, is strengthening our infrastructure. The information technology incentives that have been provided in the economic stimulus package are an important down payment on that. But we also need to support the physician infrastructure. We need support for educating more primary care doctors and other practitioners. It's critically important. And I would also argue that investments in the healthcare infrastructure are their own form of economic stimulus. Those dollars are spent in the United States. They have a tremendous multiplier effect. And but for healthcare, there would have been no jobs created over the last decade. So finally, let me say that we all have a responsibility in this. It's not the other guy's job to reform healthcare. Individuals need to make healthy lifestyle choices, and we need to be better consumers of healthcare. Healthcare providers need to do everything we can do to control costs and be transparent about our results and our costs. Businesses need to provide incentives in their healthcare plans to their employees to select more effective healthcare systems, and government has to exercise policy leadership and serve as the ultimate safety net for the most vulnerable in our society. So healthcare reform really can't wait. I know I'm out of time. We're out of time on healthcare reform. So I would just suggest that as we seek solutions, we listen to the great American writer Mark Twain. And Mark Twain advised us to always do right. He said this will astonish some people and gratify the rest.